The question that's posed at the beginning of this panel was healthcare reform, the last word or first stirrings of a larger evolution.
Exactly.
And I don't think I'll really be going out on a limb to say that I don't think it's the last word, and I do think it's the first stirring. So you have my conclusion right here up front. I think there's a lot still to be written and a lot to be said in this area of healthcare reform, and this is the beginning of a larger and long process. To make it easier on everybody, I'm just going to say my 5 points right up front, and then I'll go explicate further on all of them. I'm going to talk about the 5 C's. Number 1, comparative effectiveness 2. Number 2, consequences, intended and unintended. Number 3, the complex process. Number 4, the covereds and companies, what do they do? And number 5, cost, and that's something I know Dr. Fu talked about at the end of his remarks as well. Dr. Koo laid out a long series of items that are in this bill. I know he said he was talking about it at 100 pages a minute. I guess the bill is 1,000 pages or 2,700 pages, depending on what font you used or something like that. But there clearly is a lot in the bill. I counted over 50 major provisions just in the bill itself. And then on top of that, the reason I call this section comparative effectiveness 2, and if Dr. Fu talked a little bit about comparative effectiveness, this is on top of 2 major changes in healthcare reform, or in the area of healthcare that began even at the beginning of the Obama administration, before we even passed this bill, which were in the stimulus package. There was comparative effectiveness. $1.1 billion went to this new type of research that compares different therapies. It can be a drug to a device, a device to a device, drug to drug. There are different ways of doing it, but it compares different therapies and tries to say what works better and what's more cost effective. President Obama touched on this when he talked in one of his press conferences about health reform, when he talked about, well, if you get a red pill or a blue pill and they're equally effective, but one is half the price, shouldn't you take the one that's half the price? I wish all comparative effectiveness research came out that easily and that simply and that definitively, but that's basically the idea of comparative effectiveness, and so we are putting $1.1 billion into it, divided between the NIH, the National Institute of Health, the ARC, which is the Agency for Healthcare Research and Quality, and the Office of the Secretary. That $1.1 billion is divided up there. And then, of course, you have the stimulus package, health and information technology dollars, and that's about $20 billion. That's a net number. There are assumed about $10 billion savings from adopting health information technology. So it's really over $30 billion in gross spending on health information technology. And these are electronic medical records requiring hospitals and doctors who take Medicare payments and that's the vast majority of doctors, to adopt approved health information technologies, approved electronic medical records. By the year 2015, they get a subsidy for doing it in the period between 2011 and 2015. But after 2015, they are penalized for not doing it. So those are 2 types of important stirrings that are going on in the health sphere. And then on top of that, we have this new bill, and Dr. Q, I thought, did a very good job of laying out what the bill does. So that will take me to my next section, which is the issue of consequence, or intended and unintended. I think for the most part, and I'll talk about the exception at the end, for the most part, the bill does what it says it's going to do to the people to whom it says it's going to do it. So the intent of the bill is to expand coverage to people who either don't have it or have trouble getting it by having a series of subsidies and exchanges, but also by imposing new requirements on the insurance companies, including the requirement that they have to cover people under the parents until age 26, the elimination of rescissions, where you can just drop someone from coverage, the medical loss ratios, which is the requirement that you have to have 80% or 85% of dollars go into medical care, depending on what type of insurance plan you are. And these are things that I like to say that the insurance companies kind of brought upon themselves. They had a lot of policies that were not seen as very nice, that the American people didn't like, that got them into trouble time and time again. And it seemed to me only a matter of time before these type of requirements were imposed on the insurance companies, and that is a big section of the bill. But there's another part So that's what's intended in the bill. The unintended consequences are what's going to happen to the other people who the bill's not necessarily aimed at, which are the people who are in the who are already covered, the people who get their coverage through their employers, which is the bulk of people who do get health insurance and who seem to like it. The third is, and really what this panel is about, is the complex process. The bill is now passed, and it's whether 1,000 or 2,700 pages, whatever it is, there will be many more pages of regulations that are written to implement the bill. And regulation writing is a very long and arduous process. There's a study done by somebody I used to work with who is at OMB, the Office of Management and Budget, the office of the office that kind of handles the regulations for all the federal government. He said that writing a complex rule takes about 830 days on average, and these rules definitely count as complex. So what you have with this is people talk about, oh, it's 4 years, it seems like they have forever to implement, but if the average is 830 days, they really don't have that much time to implement it. It's going to be a heavy burden on the Department of Health and Human Services, where I used to work, to get all this done in time. And I know some people in the council's office who are already talking about how they are kind of burdened with writing a lot of regulations. There's just a lot of that going on right now. And every regulation has a complex process that includes notice and comment and 30, 60, 90-day waiting periods, and going through OMB review, going back to the Secretary's office. I think if you count it all up in the bill, there's 160 instances of the Secretary shall, meaning that these are things that the Secretary has to do. She has a lot on her plate.